Food allergies or food toxicities. So these are some symptoms that you can have when you have food allergies: fatigue, constipation, diarrhea, reflux, bloating, flatulence or gas, abdominal pain, skin rashes, itching, joint and body pain, sinus congestion, brain fog. A lot of this, including the skin rashes, has to do with the immune system's reactivity to something. And remember, when it's reacting to something, it causes inflammation. And the body, with a lot of these things, the body's just trying to get rid of whatever is causing the problem. And the inflammation gets out of whack and gets stuck in the on position, and that's when you get pain and dysfunction. So the testing that we want to do the food elimination diet. So you remove the foods, usually the top 10 food allergens, for 3 weeks. And then you reintroduce one new food every 4 days. I do like to separate out different classes of foods. So for dairy, you would introduce different kinds of dairy. Now, if you react to something, then you remove it and you have to get back to baseline until you introduce the next thing. The IgG food allergy test, blood spot, is optional. I haven't found these tests to be especially good, but if you really want that data, sometimes it can pick up something that can be helpful. And so the objective data is the reaction to the food upon introduction. So when you're doing after you've done the food elimination diet, when you reintroduce it, it's called the oral food challenge test. You're basically challenging your body. It takes 3 weeks to get your immune system to stop reacting to something. So then if you introduce it, let's say you're introducing dairy. Let's say you love ice cream. So you have an ice cream party on day 1 of introduction, and then you wait day 2, day 3 before you introduce something new on day 4. If you react in those days, it's due to the ice cream. Okay, so that kind of gives you an idea about, and that's pretty darn objective data. You just have to pay attention because you're going to get the message. You're going to get constipated. You're going to get a skin rash. You're going to get acne like I did. I had bad cystic acne growing up from dairy. So there's all sorts of different things that can pop up. And in my experience, it's very likely that someone has a food allergy if they eliminate the food for 3 weeks, then reintroduce it and experience negative symptoms. This is the gold standard for food allergy testing. Blood test is complementary, but not very accurate. So make the conclusion. One other nuance to that is that gluten oftentimes has to be out of the body for about 3 months before you add it in. And remember, there's a lot of gluten mimickers, proteins that look like gluten to the body. So oats need to be eliminated. Even if they're gluten-free oats, sometimes they are still not good for an individual. So things to pay attention to. And there is some additional testing that can be done to determine whether someone has some cross-reactivity with gliadin or gluten proteins. So make your determination.